So I know we've been speaking to this in kind of the acute setting, hospital setting, but Sam, you're using it at a surgery center. Are there nuances? Is it a little bit different in, that surgery center or ASC setting than it is in a more traditional acute setting?
That when you talked about the menu approach as far as purchasing Leaprail, when we first started, we have two hospital campuses, and we started with both campuses. And then once we saw the value, we expanded to our ASC. And there are, really, as far as nuances, the ASCs have just a fast turnovers. But what's nice about it is that all the staff can see the progression of the cases. They know what's been done, what's coming up, but also it gives value because, like, if I'm here at the hospital and I'm looking and I can see that the ASC is almost done with their cases and it's only noon, and I have a couple of add-ons and I can use those anesthesiologists here at the hospital to get some of these add-ons done, we ask those anesthesiologists to come to the hospital and help clean up. Let's get some of these add-ons taken care of. Same thing when you have, yeah, two hospitals, one team. In order to know what was going on at the other hospital, you had to call and find out where are you guys with the cases, how much longer. Well, now we can see both campuses and we can see where they are in their cases. So no, there were no. There may have been some nuances, like when we first launched it in the ASC, but since then that's all been dissipated, and now we just basically rely on each other. We can see who has what going on, and if someone needs help, how can we help each other out? So
I think that's really, really helpful in the not just with your people utilization, because obviously it is. You're utilizing your rooms well, you're moving people where you need them. If they work at that campus or work at that facility, you can move them around to get your cases done, which obviously helps your staff, helps people get out on time. Cases aren't sitting around waiting longer because you didn't know that somebody was free. But then you also think about that patient, that add on patient who needs to go. Maybe they don't need to be emergently added on, but if I had the option to have my case done at 2 in the afternoon, or I had to wait until 9 o'clock at night just because of how things fell, of course I would want to be done earlier so that I could have my case done and then get on with the healing process as any other patient would. So to think about the downstream effects of patient care, quality patient care, a good patient experience for the patients and their families, that is a great effect to have just by being able to see who you have free, see where they're available, and how you can use your staff efficiently. That's fantastic.